you've learned how to help an infant who is choking. Congratulations. The knowledge you have gained today can help you change or even save someone's life. If you practice your skills often to keep them up to date, you'll have the best chances to help a person who is choking or in need of CPR AED. On behalf of the American Heart Association, thank you for taking time to attend this important course. When it comes to helping a person whose heart has stopped, there are two important things you can do. One is to give CPR, or cardiopulmonary resuscitation. The other is to use an AED, or automated external defibrillator. Today, we'll show you how to do both, because these two actions could help you save someone's life.
If they don't like the deal, they can go somewhere else. You know what? I just don't care anymore. No, that's ridiculous. No, we're not gonna do that. No, oh, my chest is starting to hurt.
Are you okay? Are you okay? You, have the manager call 911, see if they have an AED. If they do, bring it back.
Welcome to the American Heart Association's CPR AED course. Before we get started, let's define a couple of terms that you'll hear used during the course. For the purposes of this course, an adult is anyone who is going through or who has already gone through puberty. If there's any question about whether or not the person has reached puberty, treat the person as you would an adult. Someone who responds, moves, speaks, blinks, or otherwise reacts when you tap him and ask if he's okay. When you push on the chest during CPR, that's called a compression. When someone's heart stops beating, blood stops flowing through the body. CPR can help keep a person's blood flowing until other medical care can be given. The most important part of CPR is pushing hard and fast on the chest when you give compressions. When you push on the chest, you pump blood to the brain and heart. So let's focus just on compressions right now and take a look at how they should be done. Move clothes out of the way. Put the heel of one hand on the lower half of the breastbone. Put the heel of your other hand on top of the first hand. Push straight down at least 2 inches with each compression. After each compression, let the chest come back up to its normal position. This lets blood flow back into the chest. You'll need to give compressions at the rate of at least 100 per minute. So, let's practice giving compressions. You'll learn the other steps to go with this soon, but for now, we just want to work on doing a good job of giving compressions. Now, this means you'll be doing more compressions in a row for this practice than you would for a regular cycle of CPR. You see, we want to focus first on the most important part of CPR, giving compressions. Then we'll add other things you can do to help someone who needs CPR. We're going to pause the video now to allow you to get into position to practice. And throughout the course today, you'll be taking turns practicing. Whoever is last each time can stay in position when finished, since you'll be the first one to go the next time. For this practice, you should be kneeling next to the mannequin so you can watch the video as you go.
Now, let's talk about a common breathing problem, choking. In adults, choking is often caused by food blocking the airway. The block in the airway may be mild or severe. If the block in the airway is mild, the person can make sounds and cough loudly. In this case, stand by and let the person cough. If you are worried about the person's breathing, call for help.
Hey, if it isn't the muffin thief.
Always.
This guy's always taking
I'm
it.
gonna stop reading that.
Every time.
Right?
Hey, Philip, are you choking? I'm gonna help you, okay?
If the block in the airway is severe, the person cannot breathe, talk, or make sounds. They may also make the choking sign by holding their throat. If this happens, you must act right away and give abdominal thrusts to try and clear the airway. When someone's choking is severe, give thrusts slightly above the belly button. Each thrust pushes air from the lungs like a cough. This can help remove an object blocking the airway. If you think someone might be choking, first ask if the person is choking.
Are you choking?
If the person nods that he or she is choking and cannot talk, you must act.
Okay, I am going to help you.
We're not actually going to practice choking, but you can perform the following steps to help someone who is choking. When a person is choking, you'll need to give thrusts slightly above the belly button. Depending on your size and the size of the person choking, kneel or stand firmly behind the person and wrap your arms around his waist so your fists are in front. Make a fist with one hand. Put the thumb side of your fist slightly above the belly button and well below the breastbone. Grasp your fist with your other hand and give quick upward thrusts into the abdomen. Give thrusts until the object is forced out and the person can breathe, cough, or speak, or until he or she stops responding. If you cannot remove the object, the person will stop responding. If this happens, follow these steps. Call or have someone else call your emergency response number or 911. Check to see if the person needs CPR and give it if needed and you know how. Continue CPR until the person speaks, breathes,
moves, or until someone with more advanced training takes over. Remember that a 911 dispatcher often can give you instructions on how to do CPR if needed. If the choking person is in the late stages of pregnancy or is very large, put your arms under the person's armpits and your hands on the lower half of the breastbone. Pull straight back to give the chest thrusts.
This concludes the adult CPR AED section of the video. Let's take a look at what you've learned. You've learned the most important part of CPR, how to give effective compressions, by pushing down at least 2 inches at a rate of at least 100 per minute, and letting the chest come back up to normal after each compression. You've also learned how to give breaths quickly and effectively, without interrupting CPR for more than 10 seconds. You've learned how to assess the emergency and call for help. And you've learned how to add the use of an AED to give a person in cardiac arrest an even better chance for a good recovery. And you've learned how to help an adult who is choking. Just as in adults, when a child's heart stops beating, blood stops flowing through the body. But CPR can help keep a child's blood flowing until other medical care can be given.
Can I help you find anything?
Oh, no thank you. I'm just looking.
Let me know.
Okay. Boys, stop running through the store. Get over here.
You can't catch me. Oh, that's what you think. Mom, come quick.
Boys, what happened?
He fainted again. Found him on the floor. I thought he was just kidding, but he's not waking up, Mom.
Help! Somebody help! What's wrong, ma'am? Are you okay?
No, my son.
Are you okay? Are you okay? Call 911 right now.
Okay.
Welcome to the Child CPR AED module of the American Heart Association's CPR AED course. CPR AED is mostly the same for children as for adults, but there are some differences, so we're going to go over those now and then give you a chance to practice a complete sequence of child CPR AED. Before we get started, let's explain what we mean by child. For the purposes of this course, a child is anyone who is older than 1 year and has not yet reached puberty. If there's any question about whether or not the person has reached puberty, treat the person as you would an adult. As we mentioned before, compressions are the most important part of CPR. One difference between adult and child CPR is how compressions are done. When giving compressions to a child, you may only need to use one hand. However, you should still be able to push down about 2 inches. If you can't do this with one hand, then use two. As in adult CPR, sometimes people don't push hard enough during child CPR because they don't want to hurt the child. However, it's better to push too hard than not hard enough. An injury is better than death. Children often have healthy hearts, but even a child's heart can stop beating if she can't breathe or has trouble breathing. So it's very important to give breaths as well as compressions to a child who needs CPR. Just as in adult CPR, opening the airway correctly will help keep a child's tongue out of the way to make sure your breaths are effective. When giving breaths to children, open the airway and give breaths that make the chest rise, just like for adults. However, for small children, you will not need to blow as much as for larger children or adults. Actually seeing the chest begin to rise is the best way to know that your breaths are effective. Masks for children are made the same way as those for adults, only smaller, to fit over the ill or injured child's mouth and nose. Again, you may need to put a mask together before you use it. Remember, there are different sizes for adults, children, and infants, so make sure you're using the right size for the child. AEDs work basically the same way for children as they do for adults. As mentioned earlier, depending on which brand of AED you use, there may be special pads or a key or switch for use on children less than about 8 years of age. If one of these is available, it should be used. However, if you only have an AED with adult pads and it doesn't have a child switch, go ahead and use it. It's better to use adult pads on a child who doesn't respond than to not use an AED at all. Follow the AED prompts and the pictures on the package or pads. If a child doesn't respond and isn't breathing or is only gasping, you need to give CPR. If you're not sure, go ahead and give CPR. It's better to give CPR to someone who doesn't need it than to not give it to someone who does. Since children usually have healthy hearts and breathing trouble is often the cause of a child needing CPR, it's important to get air to a child quickly if he needs CPR. If you're alone when you find a child who needs CPR, you should immediately give 5 sets of 30 compressions and 2 breaths first. Then you can go call your emergency response number and get an AED if it's available. Okay, now let's see what it looks like when you combine everything you've learned together. We're going to show you a demonstration of a complete sequence of child CPR, including the use of an AED. For this demonstration, the rescuer will be alone. Pay close attention because you'll get a chance to practice afterwards. If you find a child who may need CPR, first, check to be sure the scene is safe.
The scene is safe.
Make sure the child is lying on his back on a firm, flat surface. Tap and shout to see if the child responds.
Hey, are you okay? Can you hear me?
If not, then yell for help.
Help! Somebody, I need help!
If no one else arrives to help, then check for breathing. Check for at least 5 seconds, but no more than 10 seconds. If the child isn't breathing or is only gasping, move clothes out of the way and give 5 sets of 30 compressions and 2 breaths. Now, open the airway and give 2 breaths. Watch for the chest to rise and reopen if necessary. Repeat. After the 5th set of compressions and breaths, if no one has come to help, then go call your emergency response number or 911 and get an AED if possible. When you return to the child, turn on the AED and follow the instructions.
Attach pads to the victim's bare chest.
continuing CPR while you wait for someone with advanced training to arrive and take over. If you don't have an AED, continue CPR while you wait. And that's what child CPR looks like, including the use of an AED. Again, the first compressions are the most effective overall, and they become less effective as you go. So remember, if another trained person is present, switch rescuers at least every 2 minutes, even if you're not tired, to make sure you're giving good CPR. And remember to give feedback to the other rescuer while you are resting, to help make sure they push hard and fast. Congratulations! You've just learned CPR and AED use for children. Here's your chance to practice everything together. The following scenes will show a variety of emergencies. It will be up to you to take turns showing how you would respond to them. We're going to include using an AED, but only to the point of turning it on, since the AED will tell you what to do in a real emergency. Your instructor will guide you, and after everyone is done practicing, you'll each be tested on your child CPR AED skills. Giving CPR to an infant is very similar to that for adults, but there are a few differences.
Hey, how are my little ones doing?
As peaceful as can be. In fact, I was just about to wake little Ava. She's been so quiet. Ava, wake up, little girl. Ava? Ava, come on, you're scaring me.
What's wrong?
Lisa, I don't think she's okay.
Let me have her. You go call 911 and get some help. Ava? Ava?
Welcome to the Infant CPR module of the American Heart Association's HeartSaver CPR AED course. Before we start, let's define what we consider to be an infant. For the purposes of this course, an infant is anyone who is younger than 1 year old. Just as in adults and older children, when an infant's heart stops beating, blood stops flowing through the body. CPR can help keep an infant's blood flowing until other medical care can be given. When giving compressions to an infant, you'll need to use just 2 fingers of one hand. You should be able to push down about 1.5 inches at the rate of at least 100 compressions per minute. Pushing hard when giving compressions is just as important with infants as with adults. Make sure the infant is lying on his back on a firm, flat surface. If possible, use a surface above the ground. Move clothes out of the way. Put 2 fingers of one hand on the breastbone just below the nipple line. Press the infant's chest straight down about 1.5 inches. After each compression, let the chest come back up to its normal position. This lets blood flow back into the chest. You'll need to give compressions at the rate of at least 100 per minute. So let's practice giving compressions for an infant. We're going to pause the video now to allow you to get into position to practice. As with adult CPR, you'll be doing more compressions in a row for this practice than you would for a regular sequence of infant CPR. Again, whoever is last each time can stay in position when finished, since you'll be the first one to go the next time. For this practice, you should be standing next to where the mannequin is lying. Watch the video as you practice.